Hey guys, let's review the professionals covered today under the diagnostic and imaging chapter. So there were 6 different professionals. Who are they? You're right. First, we have the cardiographic technician. As we know, electrocardiograms or EKGs were developed by William Enthoven and are still used for this profession. Technicians assist the doctor in conducting these tests and many others. Electrodes are placed upon the patient's chest in an arrangement to measure the electrical activity of the heart. Also, cardiographic technicians perform non-invasive procedures. One of the common tests performed is known as the Holter monitor test, created by Norman Jeff Holter in 1949. This test monitors the patient's cardiac pattern by giving them a portable EKG device to wear.
What's the difference between a cardiographic technician and a cardiovascular technologist? First, cardiovascular technologists require more education and may need more years in college and be accredited by different programs. They also perform more surgical procedures than a cardiographic technician. In addition, they have a wider array of responsibilities, mostly because of their increased amount of tasks which may require invasive procedures. The difference between these tasks are shown as a reward in the increased salary of a cardiovascular technologist over a cardiographic technician. The second profession that we discussed was a cardiovascular technologist. Cardiovascular technologists deal primarily with the function of the heart and try to increase its effectiveness. Some of the procedures that they use would be 1. Using a catheter to increase blood flow in a vein. Another procedure that can be done by a cardiovascular technologist is known as balloon angioplasty. A balloon is inserted in a narrowed blood vessel to help widen it. This technique was first described by Charles Doddard, a radiologist in the US, in 1964. Its effect includes widening a specific blood vessel and decreasing the chances of a clogged vein or artery. The third professional is a phlebotomist, also known as a clinical laboratory technician. Before the advancements of recent times, bloodletting was a common technique used to balance the amount of blood in the body. The blood released was often discarded through towels and buckets, but was rarely considered useful. Excessive loss of blood could have extreme negative effects such as nausea, and the popularity of this exercise quickly subsided after the 19th century. A common responsibility of a phlebotomist is to perform a venipuncture. A venipuncture is the act of drawing blood from a vein to identify components of the blood or to determine disease. They have to make sure that patients are comfortable and enforce strict safety regulations in order to prevent infection. The blood is drawn with the use of syringes and is stored in test tubes, which are later sent to the lab to be examined.
Another one of their responsibilities is determining how effective a prescription drug is. So, for example, determining whether it's very effective by rating it a 9, or by determining it wasn't so effective by rating it a 2.
The next profession is the diagnostic medical sonographer. The history of this profession dates back to 1826 with Jean Daniel Collodon measuring the speed of sound between a church bell and ear trumpet. He and his assistants sat on boats on either end of a river, him having an ear trumpet under the water and the assistant with a church bell under the water. The assistant struck a hammer at the church bell, and Colliden was able to measure the speed of sound. The main responsibility of a diagnostic medical sonographer is to use sonography, or high-frequency sound waves, to project sounds and images onto a monitor. This procedure is known as an ultrasound. Diagnostic medical sonographers usually work with pregnant patients to view images of the fetus inside the mother.
The fifth profession is the radiologic technologist, or the radiographer for short. The primary equipment that a radiographer uses is the X-ray. X-rays make diagnosis easier because they are non-invasive. On the electromagnetic spectrum, they rank second, and this allows them to pass through certain structures. Radiographers may provide a patient with a contrast medium to help make their soft tissues more visible. They may also conduct a fluoroscopy, which is a use of continuous beams of X-rays and allows them to see movement inside the patient's body. These technological advances allow the radiographer to be as effective and efficient as possible.
Lastly, we have nuclear medical technologists. They specialize in nuclear medicine, and nuclear medicine is the use of radioactive materials inside the body to create diagnostic images or to treat cancer and other diseases. Some common medical procedures are bone scans for orthopedic injuries, lung scans for blood clots, and cardiac stress tests that gauge the heart's degree of function. Their major responsibility is to perform diagnostic scans, and those diagnostic scans show the function of organs and tissues. Some examples are PET scans, SPECT scans, bone scans, and cardiovascular imaging. They also check equipment and perform radionuclide therapy for patients. Then they would position the patient and start the imaging. And lastly, they would select, process, and enhance those images and basically choose which one they want to send to their physicians.
We hope that you learned a little bit more about the diagnostic and imaging professionals by our presentation today, and thank you for watching.